Myself, Dr. Vishwanath Wasedar. Today we are going to hear the lesson or a class on Introduction to Swedana, definition, etymology, and indications, and we'll read it later. And Swedana, Dravyas, and its properties. It's in a first class of Swedana where we are going to learn about the basics. Coming to the contents, these points will deal in the coming presentations. Introduction. The therapeutic sweating or fermentation or sudation are the synonyms of Swedana, or the English literature can have a translation word, but it is not equal to the Swedana. To be frank, by medically it is called as a diaphoresis. The process which relieves the stiffness, heaviness, coldness of the body and produces Swedana when you talk in translated language. Sweat is the waste product, that is what Ayurveda calls is mala, in the process of metabolism of the Meda Dhatu, fat, what you consider fat in the body. It's one of the byproduct. Sweat carry the water soluble waste products from the body. It is one of the Purvakarma, which may be sometimes Pradhana also, Paschat also, but majorly it may play a role of Purvakarma. By means of Swedana, toxins are excreted out of the body, and Swedana helps to liquefy the doshas and bring them to the kosta, as also helps to remove the source of Shodhana. Then coming to the definition. What is exactly the definition? Stamba Gaurava Shitagnam Swedanam Swedakarakam. See that, which I already explained as an English translation. Stamba Gaurava Shitagnam Swedanam Swedaka. In Ayurveda, any definition or any physiological, any Panchakarma is entertained with their physiological limitations, because acharyas are identified the demarcations and therapeutic benefit on the levels of physiological output has been identified. Here, the physiologically it is thermoregulatory process, and therapeutically is induced to eliminate the bio-waste or malas or material from the body, where the basic physiology of the body has been utilized in the therapeutic effect, where the impact of therapy will influence the physiology and the patient will get a benefit out of it. Then coming to how one by one word we'll study as we were put the definition. What is a stamba? It is of two types. Don't think all the time Tamba is kapha. It is vata and vata kaphaja, or kevala vatajanya kapha or kaphajanya. Here in vatajanya, it's most of the time central nervous system induced neurological deficiencies can be taken in the conditions. There are some movement disorders, that is hypokinetic, that is Parkinson's, secondary to the Parkinson's, and drug induced sometimes, hyperkinetic tremor, essential tremors, and chorea, Huntington chorea, dystonia, tics, Wilson's disease, mental retardation, cerebral palsy, spastic paralysis, so many conditions which you can diagnose under the category of Vata Pradhana Lakshanas or Kevala Vatajanya. Now, because this is the basic diagnosis, when if you do, then the type of the Swedana which is going to adapt it in the process of practice, it is very important. When it is Vata Kaphaja, Avarana condition, cervical spondylosis, lumbar spondylosis, Katigraha, Amavata, so many conditions, Sandhigata Vata with Samadoshas, so many conditions which can be identified under the influence of Vata Kaphaja, because this makes the difference in the management of the particular disease with their particular dosha involvement. If you are not good enough to understand this pathology, then it may give a wrong interpretation, will lead to the wrong treatment. Application of Snehana, Snigdha and Ruksha Sweda may go wrong. So it is very important. That's why Stamba, it's a one first word which is identified. Swedana is not only a sweating, where Swedana is a process where it is going to reduce this sambata of two variants, that is Vata Kapha and Vataja. This is also called as Swedana therapeutic effect. Means by doing this process you can reduce this symptom in the body. It may not be on a first day, or it may not be a total treatment outcome, may be a possibility. Don't expect on a first day. Means because of practice of this you will get 100% effect on the stamba by relieving. But stamba should be analyzed in its figure of vata involvement or kapha involvement. The particular sweda will be adapted. That has an option. Then coming to the gaurava. Gauravam. There is a fatigue, lethargy, heaviness of the body can be translated in English. Heaviness in terms of substances, that is Gurutvam, Jala, Bhujam, Patanam, means where the liquid dominancy and where the snigdha dominancy is there, that can be considered under the example of Gaurava elements. In the obesity persons, there where the kledha is increased, there may be a possibility of Gaurava. Elemental relationship, that is Gauravam, Prithvi Maha, Appa Mahabhutam. This is the dominance of Prithvi and Up, because the therapeutic effect of Sweda may reduce this process and reduces the Drava Shoshanam or Ap Mahabhuta Shoshanam, or Prithvi with loaded with thickness of the body can be reduced. Effect on dosha, that is Guru Vata Haranam Pushti Shleshma Kritam Chiram Pakam. Effect on the tissues, Yasya Dravyasya Brahmane Karmanami Shakti Sa Guru Hemadri Sadaha Upaye Lepam Bahukalpam, means what? Which all the drugs which will induced or Santarpamata Vyadis are most of the time the Gaurava dominant, where the application of Swedana is one of the choice. But in Madhumeha it is contraindicated because of this Veda Dushti has taken place in the Madhumeha. Because of that reason it is contraindicated. Don't, because before that it can be adapted. Example, Tandra in Kafajajara, where Gaurava in Panduroga, Guruta in the Raja Ikshma, Gauravata in the Amavata. So many examples. Means application of Gaurava is very important. Stavula in the Gaurava, Kapha Prakriti Gaurava Lakshana, because these are the identified clinical course of the diseases, which you will identify the clinical conditions where the application of Swedana is going to matter, and there is, you are going to reduce this symptoms. Means the tissue level transformation or the Bhutagni or Dhatvagnis get converted into the functional. Normally, the person, even though maybe is obesity, he may do good work. Example, Sachin Tendulkar was playing a very good cricket when he was more obese. Means his Gauravata Lakshana was absent. I am not telling that all the obese patients are having this symptom. Only pathological non-functioning of the Dhatvagni and Bhutagni may induce this process of Gauravata. That is one of the identifications. Some of the people are so much obese, but they never do any heaviness of this Tandra Gaurava Lakshanas are may not be present. Some are very lean, but there is a dominancy of the these symptoms. So where the application of Swedana is in a clinical, and Swedana second importance word is Gaurava is reduced by the Swedana, not only sweating. Don't think the sweating is the last process of therapeutic effect where you have to stop the sweat process of sedation or the therapy. Coming to the Gaurava physiological, the brain is going to give the governance in the brain or the heart, causing a showing of the circulation. Heart causes muscle fatigue and mitochondrial releasement. That is what the Dhatvagni and Bhutavagni I am telling. It's in the level of the mitochondrial metabolism. It may induce such types of, when you read from the point of physiological entity, where mitochondrial metabolism and limiting the blood flow and muscle fibers and causing the, that is Dhatvagni Manda, it can be considered Bhutagni Manda, particular tissue is not getting digested. Then because of this reason it may go into the lactic acid or normal physiology. So example, in Vata Rakta there is a Gaurava in the legs, there may be a lactic acid cycle or ischemic changes may make the Gaurava of that particular leg. This is what I am telling. It is from the simple heaviness of the body to the simple, it may be a ischemic condition. And maximal cardiac output, limiting coronary artery blood supply leading to the mitochondrial ischemia. Means every time it will not happen like this. But how to understand an Gaurava? This is one of the simple physiological example where the reduction in the Dhatvagni metabolism leading to the heaviness because of the lack of metabolism, there is no food conversion into a energy level where there is a Gaurava. Maybe the dominancy can be taken into consider. Then coming to the Shitagnam, yes, Charaka identified two first clinical entities, which is very important, where you have to indicate these things in Stambhata, where Gauravata is there. Then coming to the Shitagnam, this may not be a clinical entity which you may not feel, and it may be feel in Shita Jwara, but my point of view, understanding of Shitagna can be taken is that it may influence the person's temperature metabolism. See, temperature is regulated by the homeostasis Homeostasis, which is in the main, and the hypothalamus is the main part of the body which is going to involve in the process of regulation of the temperature. Here there are two parts of the hypothalamus has to be taken into consideration for the understanding. Because of the application of sweating or application of Swedana, it will influence the brain to do physiological adaptation with respect to the given temperature. How it may happen? There are two parts of the hypothalamus which are present in the hypothalamus in the brain. They are anterior hypothalamus and posterior hypothalamus, that is preoptic anterior hypothalamus and posterior hypothalamus. And heat loss is the anterior part of the hypothalamus is going to take place, and heat gain is done by the posterior hypothalamus. There is a good synchronization between these two parts will make the physiological changes in the body, where the charaka was well identified after application of Swedana. This particular physiology will get activated and the person will feel the increased temperature. Because of this reason, the physiological heat loss is going to get ready and it will inform to the anterior center, and it will give the results that there is a opening of sweat glands and the increased blood supply to the external part of the peripheral neuro input. So because of this reason, the physiological sweating is released. This is one of the important criteria which you can study under the Sheetagnam. He never told that this is what the definition. It may influence till the level, it may 100% influence the Sheetagna till the level of hypothalamus. This is one of the physiological. That's why it has been told in the definition. Coming to the Swedana. Yes, after this, the process of sweating will take place inside the body and it will get stopped. You have to stop because there is the physiological Swedana. Till that, this is the process is called as Swedana. Then Swedakarakam, even though it is going to induce the sweat. If you go into the sweat, there are two types of the sweat gland, that is eccrine and apocrine glands. Okay, these are very important, and there is eccrine glands are present in from the by birth, and apocrines will come into your body after your puberty. That's why it may get atrophied or non-functioning after the age of after the 65 years or 70 years they start non-functioning. That's why the Swedana indications you go and contraindicate Vala and Buddha are contraindicated because of this reason. Maybe apocrine glands are non-functioning or less functioning in this stage. There may be a difficulty in understanding the Samek Spinna Lakshana. Charakacharya was identified, he may be unfit. So these are the things which is very important for the Swedana. Coming to the importance of Sweda Karma, it is usually given after the Sneha Karma, sometimes, depending upon the type of the Swedana, but most of the time it is given after the Sneha Karma, is done as it helps to liquefy the Snigdhata, vitiated doshas, which are spread throughout the body. Sneha Puram Prayukte Swedanadiji Tehe Anilaha Purishamutram Sa Sajjanti Kacham. This is the reason. This is after the practice of this, the person may get relieved by the Purishamutram Sa Sajjanti Kacham. Shushkanapi Kastani Sweda Sneha Swedopapadanahi Namayanti Yatanayam Kun Punarjivitanaraha. See, there is a process which you apply this Swedana and Snehana in a dry stick, and if you bend a dry stick it may get broken. When you apply this Snehana to that particular, do this Snehana, then give Swedana, give this Snehana, and it can be easily bent. Why not the humans? Anything, anywhere which is not bending, not exactly that bending, any movement is restricted in the body, it can be taken under clinical category and apply this Swedana and Snehana. It is easy to bend. That is the message conveyed by the Acharyas. Continuation. Vyadau Shite Sharirecha Mahan Svedo Mahabale. If the patient is suffering with Shita Guna dominance, then Mahan Sveda. Daurbale, Durbale, Svedo, Madhyame. If the Bala is Durbala patient, then go for Madhyama. Vata Shirishmana, Vate, Vakafe, Vasvedo, Ishate, Snigdha Rukshaseta, Snigdha Rukshasa. There are the types, and depending upon the clinical stages and types of the Vyadi, you can identify you can identify the type of Sweda, and where you are also in the integrity, Mahan, Madhyama and Mrudu Sweda can be one of the choice depending upon the need of the patient and the type of the Sweda and quantity of the Sweda and intensity of the Sweda is well identified. And apart from this, the Svedopakadravas, coming to the Svedopakadravas, these are the Svedopakadravas, Shobhanjanam, I'll come to the one by one later, and there are, before going to that, he has given 10 Svedopakadravas, but which may have a bearing the qualities like Ushnam, Tikshnam, Saram, Snigdam, Ruksham, Sukshmam, Dhram, Stirha, Dravyam, Gurucha, Yat, Prapta, see that. See, he has given some qualities for a particular, if the dravya is bearing this quality, it can be utilized under the category of Svedopaka and it is used. See, it is not mandatory to tell that all the gunas should be present in all the dravyas. If all the gunas should be present, it is very difficult because Ushnam, Tikshnam, Saram, Snigdam, Ruksham. See, Snigdha, Ruksham may not be present in a single dravya because Sukshma Guru may not be present in single dravya. Means the message is conveyed depending upon the type of Sweda. There are some drug changes may take place, but basic qualities of this quality should be present in the medicine which you are using for the Swedanartham. So you may get therapeutic effect of Swedana. That is the intention behind telling the qualities. Now coming to the She Guru. Shobhan, the Latin name is Moringa oleifera. It is Katutiktam, Laghu, Ruksha, Tikshna. These are the guna which are present in Katuvira, Ushna, Vipam. So this is the message. It can be used in the category of Shobhanjana is used in the category of Svedanopaga. This is the drug which you already every day. It's a drumstick. Leaves can be used. Eranda, everybody know richness, feminist, and Madhura, Katu, Kashaya, and Tikta, Sukshma, Ushna Guna, Madhura, Vipaka. See that. These are the qualities. Eranda. And leaves, bark, and the roots also can be used depending upon the need of the clinical practice is very important. Punarnava. Latin name is Voya diffusa, Madhura, Tikta, Kashaya, Lagu, Ruksha. See that. Katuvipaka, Virya, Ushna. So I am telling you example and he identified some 10 drugs where which will help in the okay. Next, coming to the Arka, the rest of the Procera or Gingivita and Katu Tikta, Anagu, Ruksha and Katu and Ushnavirya. Arka can be used for Swedana. This is what the Arka. Then coming to the Mahasha, Latin name, Madhura, Guru Snigdha, say the Snigdha, Ushna, because it may be a practice of Snigdha variety of Sweda, Ushna, Madhura. Okay, it may be used, the grain can be used for Mahasha. Okay, Pindasveda and all. Latin name of Yava, Hormodas Valigarate, and Kashaya, Madhura, Ruksha, Katu, Shita. These are the Shita Vira. See that. Here it is Shita Vira, but Yava can be used. What I am telling, because Shita Vira is not dominating property, Ruksha Guna is maybe a dominant property. Yava and Goduma are having a developed practice. When you read the Langana Brahmani Adhyaya, he told that it may be Avatarpana, it may be Santarpana. The process of, if you take Payasam, you cook with milk, you may get Brahmana effect, Snigdha effect. If you process with the Ruksha Dravyas, it may give Avatarpana effect or Vedana effect. That's what this is Yava. Okay, Kulatta, very important. Okay, Latin name Delicosa, fibrous, Madhura, Lagu, Ruksha, Vedana, Ushna, Amla. Very important dravya in the practice of Kola Kulatta. So many churnas you used in the practice of Kulatta. Okay, then coming to Kulatta dravya, then we will come to the Badara. Okay, Badara is Jijiva and Madhura Kashaya Katu, Snigdha, it is Snigdha. Shita. Okay, this also can be one of the choice for the drug. It's Badara, fruit I am showing you here. Tila, yes, Sesamus indicum, Madhura Tikta, Ushna, Virya, Sukshma, Guna. It is most of Tilapindas Veda. Snigdha Guna is important here. Madhura Vipaka. Okay, it's Krishna Tila and Shweta Tila. There are two entities. This is the thank you. These are the dravyas which you are used in your clinical practice. So with this, what you have to learn is the application of dravyas has made you to usage, and it may be apart from this some dravyas also used. I am not telling. But these are the basic bearing qualities, means Valuka we use, Gomaya we use, Lavana we use, and so many other dravyas also explained in the Vastrantaritam, sorry, Pindasveda, Chuna Pindasveda, where Shastika Shali, Goduma, so many things are told for usage of this. So my intention telling behind the point of understanding is that the application of guna into a particular yoga, and it can be utilized in your clinical practice. The intention of learning guna is not that all the guna should present in all the dravyas. The possible need of the treatment, that particular guna should be present in the dravya, so that can be applied where you need. This is the basic information and introductory class of the Swedana, and more sufficient. If anything is you need it, we'll have a discussion class tomorrow. There, if you have any questions, or go through the video and let me know the important points what you need. With this, thank you.